Checks provider order regarding catheterization prescription. Gathers supplies and checks integrity of packaging. Introduces self formally using full name and identifies self as a nursing student from the University of Windsor and states their pronouns as well as their role.
Hi, my name is Gabriella DeJesu. I'm a fourth-year nursing student at the University of Windsor. I identify as she, her, and today I'm going to be inserting a catheter.
Identifies the patient with two identifiers and confirms with the armband and asks how they would like to be addressed as well as their pronouns.
So I'm just going to confirm your first and last name along with your date of birth and check it with your armband. And what are your preferred pronouns and how would you like to be addressed?
Explains procedure to patient and obtains verbal consent.
So the reason why we are inserting the catheter today is because we've been having difficulty voiding. So the catheter is going to help drain your bladder. Do you consent to this procedure?
Check patient's armband or chart for allergies and confirms by asking the patient. This can include latex, betadine, shellfish, cleansing solutions, and tape.
Do you have any allergies I should be aware of? I noticed an allergy alert band here. I'm just going to compare it with your order and your mark.
Assess the patient's status. Last void bladder distension, IV infusing, post-void residual bladder scan, physical limitations, age and anatomy, LOC, and the reason for catheterization. Must state too. States that they would assess the need for and provide pericare if needed. Positions self on the dominant hand side of the bed and positions the tray and bed at a comfortable working height. Raises bed rail on opposite side of the bed, positions patient appropriately, ensuring adequate lighting. Performs hand hygiene and opens sterile tray using sterile technique. Does not open with arm over the top of the sterile field. Sets up sterile field correctly using outer forceps. Must not cross hands or arms over sterile fields and put tips of forceps inside the 1-inch border. Removes garbage bag and sets up proper working triangle. Garbage bag is within reach of working area but preventing cross-contamination. Place catheter on tray correctly, maintaining sterility. If a solution is required for cleansing swabs, check the expiration date of the cleansing solution and pour off as needed. Cleansing techniques may depend on the catheter kit provided by the organization. Don sterile gloves correctly. Organize the sterile fields correctly. Lubricate catheter 2.5 to 5 centimeters. Prepare cleansing swabs. Open the C&S container if required. For an indwelling catheter, follow the manufacturer's instructions. Manufacturers are currently not requiring testing balloons at Windsor Regional Hospital, Blue Water Health, or Chatham-Kent Health Alliance. Apply sterile drapes correctly, maintaining sterility throughout. Place sterile tray with contents on sterile drape. Cleanse meatus properly. For assigned female at birth patient, far side, near side, then middle. or for an assigned male at birth, circular motion around meatus, inner to outer, times 3 swabs. Insert catheter until urine flows approximately 5 to 7.5 centimeters for assigned female at birth, or 17 to 22.5 centimeters for assigned male at birth. When urine appears, advance the catheter another 5 centimeters. Do not force resistance. Maintain surgical asepsis throughout the procedure. States, if using an indwelling Foley catheter, inflate balloon as per manufacturer recommendations. If using a straight catheter, allow urine to drain. States, ask patient if there is pain on inflation of balloon. If pain is present, the balloon deflates and advances a little more. If pain is present on the second attempt, states would obtain assistance. For an indwelling catheter, test catheter by pulling back slightly. For an indwelling catheter, anchor and secure the catheter to leg using correct stabilizer device or uses tape, and assist patient and client into comfortable position. Cleanses the perineal area and lowers the bed and disposes of equipment. Performs hand hygiene and labels specimen if required. Repositions the patient and client for comfort and performs safety checks and asks patient and client if they have any questions before leaving the room.
Do you have any questions for me before I leave the room?
Performs the skill in a timely manner. Communicates therapeutically with patient and client throughout the procedure. And finally states what would be documented.